It's invaluable information. But these young people turned 18 in 2018, 2019. I mean, I'm sorry, 2013, 2014. That's actually early in the life of this law. And towards the end of my talk, I'll give a really good example of how early it is in terms of the actual implementation of the law and what's available to young people. Another big takeaway that we're focused on, and these are new findings, and the report on this will be coming out shortly, but these slides are public information because I included this in an earlier presentation that CDSS has reviewed, is what's the relationship between extended foster care and youth outcomes at age 23. And we're particularly interested here in whether extended foster care has legs, to use, a term of art there. Does it matter? Maybe it matters in terms of preventing homelessness while you're in extended foster care. Maybe young people remain in foster care are more likely to go to college, but after 21, we don't really see any benefits. And I think this particularly comes up because of prior research I did that on homelessness that, found that a lot of young people after they age out, regardless, become homeless. But I think the findings here are pretty good. So what we're trying to do with this body of work that we do is look at the relationship between extended care and outcomes. And we've done this 3 times now at 19, 21, 23. Hey, does it appear to matter whether young people remain in care? And so we look at lots of outcomes. I've listed them there, but the one I'm going to focus on primarily today is education. And what we're really asking that I'm going to share with you is more time in extended foster care prior to the age of 21, because you can't be in extended foster care after that, associated with outcomes at age 23. And this is, we're able to follow young people, 622 of them we interviewed at age 23. And we linked that with 2 sources of information: their self-report on whether they've gone to college, persisted, et cetera, and the National Student Clearinghouse data. And the main thing I'm going to discuss right now, controlling for a host of characteristics of these young people: demographic characteristics, maltreatment history, foster care history, mental health status, employment history, et cetera, and county context, is remaining in care associated with outcomes at age 23. And first of all, just to give you some descriptive information, you sort of already seen, remember 4/5 of them have a high school diploma or GED, a little over 3/5 have enrolled in college. 35% had enrolled in college between 21 and 23. That's something that doesn't jump out of that last slide. So there's still a lot of them in college between 21 and 23. There's also 80% of them had worked. I'm not really focusing on that today. These are the big takeaways. Again, I'm going to focus on the top of this table. And what this does, the nice yellow arrows there that my colleague Nate Ockpitch put into the table, which helps, is to make things simple. What is each additional year in foster care after your 18th birthday? What's the impact of that, if you like, on enrolling in college, persisting in college, et cetera? And all of these are statistically significant, and I'll describe them in turn here. So every additional year the young people spend in care between 18 and 21 increased the probability that young people completed high school credential by about 8 percentage points. And that persisted to age 23. We saw that all the way at age 23. Of course, all that happened earlier, so that's not surprising. It increased their expected probability of ever enrolling in college by about 10 to 12 percentage points. That's kind of a big deal. And the other thing is that means that it's not like, okay, the young people remaining in care went to college, but the others caught up. We don't see the others catching up between 21 and 23. And it also increased their expected probability of enrolling in college since the last interview by 7 percentage points. Well, the last interview was at 21. So we're seeing that the amount of time you spent in extended foster care past your 18th birthday is positively associated with the fact that you continue to go to college basically between 21 and 23. And it also increased their expected probability of completing either a 2-year or 4-year college degree by about 3 percentage points. So that's good news. I want to say, though, with a caveat, that's good news based on these self-report data. Now, what are the advantages and disadvantages of self-report data? Advantages of self-report data is it's much richer than the administrative data. We know much, much more about the 622 young people we interviewed at age 23 than we know about other young people in our huge administrative data sample who get to the age of 23, because all we know about them is what shows up in the child welfare administrative data. We don't even know, for example, whether they graduated from high school or not, because we don't have data on that yet. Hopefully we'll get that. So that's an advantage of these data. And we statistically control for lots of things to try to see whether extended care makes a difference. But nevertheless, maybe we're not measuring something that is, predicts whether young people remain in care or not. The advantage of the administrative data is that those data go from before this law went into effect to after the law went into effect. And without getting into all the fancy statistics, let me just say that that allows us to do some things that we couldn't otherwise do. We're not just looking at young people who stayed in care for whatever reason after the law went into effect. We're comparing over time. We can look at, general trends in education over time. And the other thing we take advantage of is the fact that, for better or worse, there's big variability between counties in California in how long young people remain in extended foster care. That's a whole thing I can talk about that's of great interest to us because it's a county administered state, California, and county context matters for other reasons that I'll give some examples of in a minute. So what we do is we take advantage of that big variability between counties to look at what's the impact of being in a county where you're likely to stay in care longer. So that's really not a characteristic of the young people. It's a characteristic of something separate from the young people. So it allows us another way to make a causal argument about the impact of extended care on these outcomes. When we do that, our findings are a bit more tentative with respect to the benefits of extended care. So this table actually shows the same 4 outcomes that I shared with you before based on our survey data. And you can see basically what we have there at the right that says p-value IV model. I'm not going to describe an instrumental variable model, but that's basically what I was just talking about. We're looking at, okay, let's take advantage of the fact that some young people are in counties where a lot of young people remain in care long, others aren't. And what we see here is that, once we take that into account, these effects we see of the impact of extended care on the odds of enrollment are not statistically significant. In fact, the one thing that remains statistically significant is that remaining in care does increase the odds that you are ever enrolled in college by age 23 by about 40%. So that's good news. So what's my takeaway here? 2 things. One, we don't see impacts on persistence much. We see a lot. I think the argument that there's a strong relationship between extended care and young people going to college is pretty convincing, regardless of how we look at it. We see less compelling evidence that it's associated with persistence when we look at this big administrative data, but the administrative data have their weaknesses. So I'd say that's the main takeaways we have at this point. And that, I have to say, is somewhat consistent with my earlier study, the Midwest study, which was different because I'm comparing a state, Illinois, that has extended care to other states that don't. But we also saw a big uptake of young people enrolling in college, not as big of an impact on persistence and degree completion. But I would say generally our findings overall of this last round of analyses we do of the impact of extended care is that extended care positively influences a variety of things: education, employment, savings, food insecurity, criminal justice involvement, social support. And we have yet to find any evidence of harm associated with extended foster care all the way through age 23. So now what about those other questions? At the beginning, I said, we have a few questions we ask here. We want to know what the impact is, and if there's an impact, then what drives that? And we're really interested in these issues of the service delivery system in California, the county context, and the services that the state of California makes available, particularly placement types. I'll get back to that in a minute, but county context is hugely important. County context is where you live. Where you live affects whether you get a job, whether you go to school, whether you're involved in the criminal justice system, et cetera. And also it affects service delivery in California. Counties are the entity that delivers services. That is not the case in most states in the United States, but it is the case in California, New York, Ohio, some of the large ones. Little is known about how county context influences anything, frankly, in child welfare outcomes. We don't pay, we researchers, and I think, frankly, public administrators and other observers don't pay enough attention to how local county contexts, courts everywhere in the country operate at the county level, how they affect things like whether young people remain in extended foster care and then their adult outcomes. So what we do is we look at the associations, and I use that term here because I'm not ready to make a causal statement about it, but we look at the association between county level factors and youth outcomes. And so at the county context, one of the important things we look at is unemployment rate, which we have at the county level, employment or unemployment, housing affordability. We use the standard HUD affordability measure, and political geography, which is turning out to be interesting. The percentage of registered voters who define themselves as Republican at the county level. Why would we do that? There's lots of evidence that the availability of social services, investment in social services and other education, et cetera, is associated with political ideology, even within a state, particularly in a state like California, it's county administered. We also have surveys of caseworkers. I didn't talk much about that. I didn't describe the study, but we have surveys of caseworkers where we're able to get a measure of a caseworker's perception and the average perceptions of caseworkers in a county about the court personnel, supportiveness of extended foster care, training and service availability in a variety of areas, including post-secondary education, collaboration with other service systems, including post-secondary education, and also the age at which the worker thinks this young person is ready to be on their own. And also in general, when do they think young people are ready to be on their own? And then the last thing we do is we look at the proportion of caseworkers in a county who we call specialized caseworkers, that they're essentially only caring for young people, only supervising young people who are 16 or older, or they define themselves as a independent living. That's what they do. They serve transition age youth. And then for this analysis, we're looking at educational attainment. So the outcome variable, length of stay, college enrollment and persistence. I'm not going to get into where I get all these data. So here are the summary of findings we have on the relationship between county context and educational outcomes. So the economic and political context, higher young adult unemployment rates are associated with lower odds of enrolling in college. So if the labor market's poor, you're less likely to go to college in your county. If housing's expensive, you're less likely to go to college. Those shouldn't be particularly surprising, but I think they're important to recognize. They're controlling for all kinds of characteristics of kids, where they live, where these young people live in terms of the socioeconomic context mattered. Service context, greater perceived availability of post-secondary education support was associated with reduced odds of enrollment by age 21. That's kind of odd, counterintuitive. Our sense of that is that you put a lot of work into availability of these things. And it may be that workers are just aware of these kinds of supports, are in places where there's a lot of need for the support. Their perception, though, of the quality of collaboration with post-secondary education systems is positively associated with the odds of enrollment by 21. So their perception that they're actively working, their agency is actually working with post-secondary education support is positively associated. So county context matters. The county agency can't do much about the economic context, but it's important to recognize that. But the county agency and other players do have the ability, in theory, to influence collaboration with other systems, post-secondary education, and availability of services. And then lastly, I'm going to go through this quickly, influence of placement type and placement provider agency on youth outcomes. This is really important, because the major resource, the two things that extended foster care has developed that are particularly important are SILPs, so young people can remain in care, and they get a subsidy and basically once a month visit from a social worker, and whatever else the social worker or other folks can associate them with. But more importantly, and much more expensively, THP plus NMD placements, transitional housing. California is by far the state with the greatest investments in transitional housing for young adults in care, by far. And so what does that matter compared to, family foster care, relative foster care? And I'm gonna basically cut to the chase here. One thing I wanna point out though, this slide shows the percentage of young people in any year who spent most of their time in these following placements. And the thing that jumps out at me is THP NMD was not readily available really until 2015. It goes up a lot in 2014, but you begin to see a stabilization in the last few years of the availability of THP plus NMD. And so it's tricky to look at early years of extended foster care in California and interpret the impact of extended foster care when this key part of the puzzle really was not readily available. And so we're pretty cautious about that. And when we interpret findings from analyses like these, and so we focused in what I'm going to describe to you right now on the last few years of this, because at that point you have readily available THP and SILP. So is placement type associated with educational outcomes? And to simplify a complicated, fancy analysis we did, THP NMD is associated with higher estimated odds of enrollment in post-secondary education versus SILP and all other placements. So controlling for the characteristics of youth using administrative data. This isn't with our survey so much because there aren't enough young people to do that. Young people in SILPs are more likely to do this. And so the basic, there's no impact on persistence or number of quarters, but once I tell you that young people are more likely to enroll, it's kind of comparing apples and oranges anyway, to compare between how they persist, because more young people in THP are actually entering care, they're being encouraged to enter, and they're young people who are disadvantaged compared to the other young people. Because we did another analysis to show that. The policy is consistently being applied in the sense that young people in THP have more needs. The last thing I want to point out is, to keep it simple, is these are THP providers. So there's one big tick. I'll cut to the summary there. You have about 60 or so agencies, between 60 and 70 agencies that provide THP NMD. 80% of them are served by 1/3 of those providers, about 20 so. 10 providers serve 3/5 of the young people. So there's a bunch of providers, but actually relatively few of them provide the vast bulk of days of THP NMD. And the outcomes of youth, again, controlling for their characteristics and even the mix of counties that providers serve. The outcomes with youth vary significantly across these providers. I'll just show one statistic here to illustrate this point. The top row there is percentage of youth ever enrolled in college by their 21st birthday. And the first quartile means the provider at the 25th percentile of providers in terms of provider level performance. 32% of young people in those providers ever enrolled during the course of a year. If you're at the 75th percentile, it's 43%. That's actually a big difference. And I think it begs explanation. And this is a really important part of your service array, basically, is THP NMD. So it matters what kind of placement young people are in, and it matters which providers providing that placement in terms of their outcomes. So that's it. Those are some links. So I've got a bit of time here to answer questions, comments.
So there's a bunch of questions that have come in through the chat that I'm just going to ask first. So one question is, were there any racial or ethnic differences?
Yeah, so it depends on the question you're asking. So in terms of, it depends on when you ask, actually. So for example, up to age 21, actually it looked like, for example, extended foster care had greater impacts for Black youth than for white and other youth. At our most recent wave of data at age 23, and I'm just writing this up, it's reversed, which is kind of hard to explain. If we're looking at whether young people persist in college between 21 and 23, African American youth are actually less likely than white youth in particular to persist during that period of time, but they also work, they also earn more, right? So there's issues of trade-off. That's why I say it depends. Like there's issues of trade-off between the outcome we're looking at. For the most part, we actually don't see big differences in outcomes by race, except when it comes to criminal justice system involvement. And that's something I've seen in my earlier studies. Why might that be the case? Because once you're in the foster care system and you're already sampling, if you like, from marginalized families and communities. And so the differences between white young people and Black and Latinx and others, Native American, the numbers get pretty small in our survey, aren't that great, and they're not consistent. They don't always match to what you see in the general population. But these more recent findings, I think, beg question. Why is that? I don't understand why African-American youth would be less likely to go to college or persist in college between 21 and 23 because they spent longer in foster care. I mean, that's sort of counterintuitive to me. I'd say that's the main thing. And again, there's no clear pattern. But I think one way to see that is to look at our most recent report, which is available at age 23. We report on all race and ethnicity differences and gender differences. And I think as you read through it, you'll see there's not like a clear pattern of any particular group being favored. It kind of, in most cases, there's no differences. If you don't see us report a difference, that's because there wasn't one. And I think you'll see there's not any real clear patterns.
So another question was about the differences in outcomes between THP and MD and SILPs. And if you can say a little bit more, if you have any sort of theories about why THP and MD youth might be more likely than SILP youth to be enrolling in college. I think that was the outcome.
Right. And let me summarize that. I'll get back to the summary here. Well, never mind. Yes, so it's not just SILPs, by the way, it's other placements too. And in the first year, between 18 and 19, a lot of these young people are living in foster homes or non-relative foster homes. And actually that group, for some of the outcomes, young people in SILPs and THP and MD, not so much education, but employment, they're actually more likely to be working. Young people who remain in these other placements appear to be happy where they're living and not connected to work or employment compared to young people in THP, NMD, or SILP, which I think is an interesting question. It has implications for our conversations about permanency, relational permanency, legal permanency, et cetera. We're actually doing an analysis right now looking specifically at that, young people who exited before 18 to legal permanency between 16 and 18. But with respect to SILP and THP, I think our sense is that THP just offers more support. SILPs, we don't see a lot of evidence that young people in SILPs get a lot of other services beyond a stipend, which is really important, and a connection to a social worker, but a social worker who doesn't really have much time to spend with them. That the workers themselves report, one visit a month. Half of them say, we ask them, how often do you visit this person? Once a month. And then there's a few on either side of that, a few less than that, a few more, but not much. So that's our main hypothesis there, is that in California, if you're not in THP NMD, you're not likely to be getting a lot of help from the child welfare system.
So another question is, did you still find that parenting has the most aggressive impact on post-secondary education outcomes?
Yes, so that is not the analysis I have right in front of me right now. We are finishing up. We're just talking about it today. On my team meeting was earlier today with analysis of predictors of post-secondary education. And with the youth survey, we did not find any relationship between parenting one way or the other and persistence or enrolling in post-secondary education. However, we only have 600 and something young people in our study. And by 21, you don't actually get to half of them having children. If we look at the women separately, about half of them have children. So we're kind of underpowered statistically to look at that question, unfortunately, with the survey data. And it is one of the reasons that we actually have the data from CDSS now, from the Child Welfare Services case management system. There's an indicator in there of whether the young person is a parent, and it's a woefully inadequate indicator. It clearly does not capture parenting for all the young people. And we're hoping that, through our engagement with CDSS and the interest of the field in that counties will figure out a better way to keep track of which of these young people are actually parents in their administrative data.
So there's another question about is there anything more you can say about the relationship between unemployment and college enrollment?
Yeah, I mean, why is that? So I think it's the unemployment rate at the county level. So those two things taken together, the unemployment rate, the higher the unemployment rate got, controlling for the characteristics of the young people and other characteristics of the county, urbanicity, for example, the less likely they were to be going to college. Well, why is that? Because actually a lot of the young people going to school are working too. They're not mutually exclusive. And, you know, a lot of them are working, and they need to work in order to, they get their college paid for, it doesn't cost much, or they get a Pell Grant, but they need to be able to work some just to meet their basic needs or their childcare. We have an earlier analyses we've done where parenting makes a difference is you'll see some young people say, I stopped going to school because of parenting, right? It just hasn't jumped out in our analyses thus far. So I think that's where unemployment, it's a marker for how tough the labor market is, and then how expensive housing is. Again, if you have to spend more money on housing, all else being equal, your ability to go to school is impaired by that. So that's where that county context makes a difference. It's really basically just how tough it is to survive in that county.
All right. Well, I know you have a hard stop at 11, and I think I captured all of the questions. If I didn't, I apologize. But thank you so much.
You all know where to find me too. So if you want to, you know, send me an email, please do. I'd love to correspond with any or all of you.
Great.
Thanks for inviting me.
Thanks so much, Mark.
Super interesting presentation. Thank you so much, Mark.
Thanks. Well, sorry it was so quick, but it's what we had. Thanks.